Coming up on the Paw Report, we look into a fungal disease that targets dogs more than most species. In the U.S., Blastomycosis is prevalent in the Midwest and here in Illinois. Join us for a discussion with Dr. Jennifer Reinhart. We'll talk about treatment and recovery for our four-legged friends diagnosed with blasto.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. And on this episode, we have a first-time guest. We welcome from the University of Illinois Veterinary Teaching Hospital, Dr. Jennifer Reinhart. Thank you so much for making the trip south and joining us here at WEIU.
Absolutely. I'm very happy to be here.
Well, today we're talking about kind of a difficult subject matter, but very important, and that is about a fungal issue that you see in a lot of pets that you treat, and that is something called blastomycosis or blasto, and so our viewers will hear us call it blasto probably a lot through this interview. So let's start at the beginning. What is blastomycosis?
Yeah, so blasto is, as you said, a fungal infection. It happens really commonly in our area in Illinois, also like Wisconsin, down into like Kentucky, Tennessee. And as I think you alluded to, it's very common in dogs, although it can happen in other species as well, like cats and people.
You know, I'm going to rewind it just a little bit because you mentioned Wisconsin, and that's where you come from. That's where you kind of did some medical education.
That's right. I did my PhD in Wisconsin, and my husband's family is from there as well.
So you do have some ties.
Absolutely.
How could my pet be infected with blastomycosis or blasto?
Yeah, so the fungal organisms actually live in the soil, honestly, everywhere in the Midwest, but especially around in proximity to large bodies of water. And most commonly, they get it by inhaling it from the soil. You know, they're down there sniffing, or maybe there's been like a big rainstorm and that aerosolizes some of the dust, and it just kind of gets up into the air, and they inhale it. And not every animal that inhales or is exposed to blasto actually gets the disease, and we really don't exactly understand why some animals get sick from it and other animals don't. It's just at this point kind of a random assortment of animals that get it. Maybe some animals who have like immunosuppression, like they're on certain drugs, they might be more likely to get it, but most of our blasto patients are otherwise healthy, usually young, adult, active animals.
If I'm a pet owner and I'm noticing some weird things about my animal, how does it show itself?
Yeah, so blasto can look like a lot of different things because it's what we call a deep mycosis, which means that it can affect multiple different body systems. So sometimes they just, there's no specific signs. They're just, not feeling well. They're lethargic. They're not eating. Maybe they have a fever. That's quite common. But as I said before, blasto, they get it via inhalation, right? And so the lungs is the most commonly affected body system. So we may see things like coughing or shortness of breath, things like that. But then, like I said, it can go to other places as well. The skin is a really common area. So sometimes we'll see like little nodules, which sometimes will ulcerate. The lymph nodes can get big. It can get in their eyes, so they can have difficulty seeing or have pain. It can get in the bones, so they might be limping. And it can actually get in the brain as well, so they can have behavioral abnormalities from it. And so sometimes it can be really difficult, as a veterinarian and certainly as a pet owner to say, yes, my dog has blasto, because you kind of have to put the pieces together. And the more organs that are affected, the more we're like, that's starting to look like blasto. But we don't know until we run the tests for it.
I'm just using the common term, hot spots. Is that, I know pets get that, dogs get that. Does that have any sort of, does blasto show itself in something like a hot spot?
I think that to a pet owner, a hot spot and a blasto lesion might look similar, but to a veterinarian, it looks a little bit different. There can definitely be some oozing and some draining from both of them, but the blasto lesions oftentimes are like nodular, more swollen. But again, if you have concerns about any lesions, any skin abnormalities on your pet, take them to your vet.
Absolutely. It's prevalent in the Midwest and here in Illinois. Why is it in Illinois, or why in the Midwest? Is it our environmental conditions?
I don't think we exactly know, other than we know that this organism really likes the waterways that are in the Midwest. It's, it follows the Mississippi River, the Ohio River up into the St. Lawrence. They get it in southern Canada too. And for whatever reason, this is a real hot spot for it. And the disease exists in other parts of the world as well, but it's much, much more prevalent, endemic in this area of the world.
How does blasto kind of differ from other fungal infections that we hear about, read about, maybe like ringworm or something like that?
Sure, yeah. So the two most common fungal infections in animals are, as you said, ringworm, which is a skin infection, and also the other one is malassezia, which is another skin infection, and they're generally pretty easy to identify and treat. They can be managed with just oftentimes topical medications, and they don't go, as you say, deep into the body. They stay on the skin, whereas blasto, although we know it can affect the skin, that's one of the organs it likes, it's systemic. It's throughout the body, affecting multiple organs.
How do you go about diagnosing? So you come in, and I'm sure there's a series of tests, maybe skin tests, how does that go?
So, obviously the first step is that the veterinarian has to recognize that there are these specific, these organs affected in an animal living in this area. And I'd say most veterinarians in Illinois are very comfortable diagnosing blasto because we see it so commonly. But so then the next step would be to run tests. So the best way to diagnose blasto is actually to see it on a microscope. And there's lots of different ways that we can collect samples to do that. If the animal has a skin lesion that's open, then a very simple thing we can do is called an impression smear, where we take just a little slide, press it on the oozy lesion, and look at it under a microscope. And usually when you look at a lesion or a sample from an animal with blasto, the organisms are very apparent on the slide. It's usually pretty easy to find. But there may be other ways to, depending on what organs are involved, we might need to do different kinds of sampling techniques. So maybe doing what's called like a fine needle aspiration, putting a small needle into a lesion, like say a big lymph node, sucking out some cells, and again looking at it under the microscope. If we can't find it on the microscope, or if we think the blasto is in a place that's much more difficult to sample, like say the brain, then there is actually a urine test that can be performed as well that looks for little pieces of the fungus in the urine, and that's a send out test. It's usually pretty good, but the best, most concrete way to say yes, this dog has blasto is to actually see the little microscopic fungi on a sample.
Do you see a lot of cases? I know it's prevalent in the Midwest here in Illinois, but I guess when you look at all the different reasons why pets come into the vet's office, do you see a lot of cases of this?
I mean, more so than a lot of other infectious diseases, but it's certainly, not the main thing that we see, because animals come to their vet for all sorts of reasons.
Sure.
I'd say at my hospital, at the University Veterinary Teaching Hospital, we probably see like 20 to 30 cases a year. And the cases that we see tend to be the more severely affected animals, because we can provide specialty care, like say if an animal's having difficulty breathing because of their blasto. So those kinds of cases get referred to us. But I think maybe like in the veterinary literature, in the published papers and such, probably maybe like 1 in 1,000 to 1 in 10,000. So it's not overall a common disease, but it's much more common here than it is, say, in California. And so it's something that people should know about.
So the magic question, it's a big word for an awful fungus and an issue. Pet owners want to know, what can I do? I mean, once you diagnose it, what are the treatment options?
Yeah. So the best case, the best chances, of having a positive outcome are when there's early diagnosis, that we recognize it before the animal gets too severely affected, gets to the point where they're having trouble breathing from the disease. But absolutely, there are medications that can be used to treat to treat blasto, antifungal medications, which are basically like antibiotics meant specifically for fungus instead of for bacteria. But animals who are treated for blasto, unlike, say you get a bladder infection, you go on antibiotics for a few days. Treatment of blasto takes several months, and we have to monitor them closely, making sure that they're showing improvement in their symptoms, say, like if we're monitoring on x-rays of their chest, if they have disease in their chest, making sure all the skin lesions go away. And we really want to treat, honestly, always err on the side of treating longer than might be necessary, because there is always the chance of relapse, that if you don't treat long enough, that the disease could come back. And even in animals who look like they're completely resolved, even about 1 in 5 of them will still have a relapse and have to go back on medications.
That was going to be my next question. A, is it curable? And B, I guess there is a chance that it could come back if it's an airborne.
Well, yeah, I mean that's the thing, is that we see animals, if they are treated and then they relapse just within a few months, we say, okay, well, we probably never actually cleared it from the body. That we just didn't treat long enough or with good enough antifungals, and we need to go longer. But then there are the dogs, there are rare cases of dogs who get it when they're 2 and then get it again when they're 10. And that's probably reinfection, that they just live in an area where the fungus is so prevalent that they get re-exposed.
So it is curable.
It is curable, absolutely. I'd say, most, it really depends on the what organs are involved and how severely affected they are. But most animals with mild to moderate disease, where again their lungs aren't severely compromised, their brain is okay, do okay with treatment. Again, intensive treatment, but treatment.
Absolutely. And intensive treatment, but what if that intensive treatment isn't done? What if it doesn't show itself, and a pet owner doesn't really know it? It'll be fine, it'll clear up. I know what ultimately the outcome could be, but I mean, if it's prolonged.
Yeah, I mean, the earlier we identify the disease, the sooner we can get treatment started, the better the chance of having a positive outcome, and honestly, probably the shorter duration of treatment. right? Because if they just have a little bit in their body, they may not need to be treated for as long compared to an animal who has multiple organs affected. It's everywhere. Those animals need treatment for a very long time.
Each client's obviously going to be definitely different, but when you kind of look at those cases that you say that maybe the veterinary teaching hospital looks at per year, recovery and prognosis, what does that, how does that fare?
Yeah, so it's been my experience that most animals who succumb to their disease, succumb to blastomycosis, do so relatively soon, within the first couple of weeks of diagnosis, and that's because their disease is just so overwhelming. They can't breathe, or their brain is so inflamed that they can't function. And so those animals usually pass away from their disease. But when even if they're severely affected, if they come in and they show a response to treatment, they start improving, and we're able to get them discharged, able to get them go home, most of those animals do okay. Does that answer your question?
Oh, absolutely it does. Now, can this disease, this question's kind of twofold, can it be spread to, let's say, a multi-pet home? You've got maybe other dogs, maybe you have other cats, maybe you have other animals besides the two most popular, dogs and cats. And what about to humans? What about to pet owners? If I'm like, I'm afraid that I could get this.
Right, that's an excellent question, and the answer hopefully is a positive one, makes you feel better. It is not impossible, but very, very, very rare for this disease to be passed between individuals. So for the infected dog to give it to their owner or to another animal. And that's because of the biology of the organism, that it's actually, the infective form is in the soil is different than what we harbor in our body, that it actually changes. So it's actually, if you have a dog with blasto, they're not breathing it out.
I was going to say, if it's in their lungs and they're coughing, and you get up in the the face and it coughs on you.
Absolutely not. The very rare reports of it getting transmitted from a dog to a human is via bites. Bite wounds. So very, very uncommon. But we do see situations where there are multiple animals or animals and humans affected in the same home. And it's not because they're passing it between each other, it's because they have a common source of exposure. They went hunting together.
Exactly. They went in the woods together.
Right,
they went by the water together.
Exactly, yeah.
Is it possible, and pets are rambunctious, but is it possible that you can prevent them from getting this? What's the magic, theory of, I don't want my dog to get this, so what can I do?
I moved to California. No, so seriously, I think about this too, and certainly there are certain activities that increase exposure, right? Like you said, going out into the woods, but other things that, like I said, happens, say we have a big rainstorm like we did yesterday, and a lot of it gets aerosolized. You can't keep your dog or pet from getting exposed by keeping it in the house. It's everywhere and in our environment. And I don't want, I don't want people to be scared by that.
Oh, no.
Because most of us have been exposed and almost none of us get the disease. And that's true for dogs as well. But because it's the exposure is so ubiquitous, there's really nothing at this point, I think, to be done to really significantly, or there's certainly nothing that we can do to guarantee an animal won't get it in this animal. I do know that there's a company that's actually working on vaccines for fungal diseases, and so that might be something that we see in the future, but that's at least several years down the line.
Are there certain breeds that you see more of than others that get this disease?
Yeah, that's a good question. So definitely like large sporting breeds and working dogs tend to be overrepresented for blasto.
So those would be your labs, your retrievers, your pounds.
Your pointers, but we think it's honestly probably not something specific about those breeds. It's that those breeds tend to engage in behaviors activities that are going to put them at higher risk, right? Those are, the dogs who are going to be out running around on the farm, are going to be, hunting or going fishing with the family, not the poodle, the mini poodle sitting on the couch next to you.
or the toy dog that's in the purse. Or
And
whatever.
I definitely have seen blasto in those little breeds too, and in cats. So it absolutely can happen.
Going back to once they get the prognosis and then there's a treatment plan, you said that treatment plan, there is some longevity to it.
Yeah.
What does that look like? I mean, is it pills, injections, topicals, and then specifically, and I know each client is different, but if you had to give an average, is long 6 months? Is it 2 years?
Yeah.
Is it how long? What does that look like?
I'd say 6 months is probably about average, but we can see it, anywhere from just a couple of months to extending over a year. And as far as the medications, the first line medications are all oral medications given once or twice daily, depending on the drug that's chosen. In really severe or refractory cases, there's a drug called amphotericin that is given injectably that you'd actually have to go into the hospital several times a week to have an infusion given. And that's usually done over a 3 or 4 week period. But the mainstay are the oral antifungal medications. And so in those situations, we definitely want to keep an eye on them. Most of the time, you'd be coming into the vet for monitoring every month or two. We watch blood values because there can be some side effects with the medications that we want to make sure we catch. And then again, we want to make sure that we're seeing steady improvement in how the skin lesions are doing, repeating chest x-rays to make sure that the lesions in the chest are getting smaller, keeping a close eye on the eyes, because that can be it's a common site of infection and like I said, can be quite painful. They can actually develop glaucoma secondary to the infection, and in some cases they actually have to have their eyes removed to keep them comfortable. So there's really a lot of
Variables.
Stuff that goes into it, and it really comes down to which organs are affected, and that determines how we manage the disease.
I don't want to sugarcoat it, but it sure sounds like this could be a costly disease too. I mean, just given all the treatments, the diagnosis, and what can happen for 6 months. I think that's something that pet owners just need to be aware of.
Yeah, I mean the medications. The nice thing is that there are a couple different options for medication, some of which are cheaper than others. So I think that can help make things more affordable. But we're probably looking at a couple $100 a month, at least. Between the medications and the tests that need to be done for monitoring.
Are there any trials or studies, anything that you're involved with, or researchers at the University of Illinois that are involved in looking at this fungal disease and what it's going to, how changes could be made to treatment or diagnosis down the line?
Yeah. So I'm actually running a study right now. We're looking at whether or not measuring levels of the antifungal drugs in the body can actually help us improve treatment, adjusting the dose every month to make sure that the blood levels are correct, so that if we don't, to prevent toxicity, because if the drug levels get too high, they're more likely to have side effects from the drug, and if the drug levels get too low, then the drug may not be affected. So we're basically looking to see whether or not taking those measurements, watching the blood levels, will help improve treatment, help dogs get to clinical resolution more quickly and more safely. That's a study that we've actually completed enrollment on right now, so we're not accepting any new patients. We've got 5 of our dogs have already gone into remission, have successfully completed treatment, and our other guys are still are well on their way. So it's been a really good experience. We're learning a lot from them, and I certainly plan on doing some other research projects in the future. And I also know that there's some work being done at Wisconsin as well.
Couple seconds left. You know, I find this topic fascinating, and it's definitely one we've never dived into here on the Paw Report. What was your kind of drive to go in this direction of medicine?
Yeah, so I'm a pharmacologist by training. I'm also an internist, so I treat animals, but I also study drugs, basically, and so it's my my
Passion,
goal.
yeah.
Well, yeah, to optimize therapies, right? To try to find either new drugs or ways to make drugs work better and more safely, like I was just saying. And coming from Illinois, I did my vet school at Illinois and then came back as faculty. And so Blasto is, as I said, it's big here. It's something that is really an important disease in this area. And so knowing that, I had the skills to help, maybe,
Yes.
help improve treatment for this disease, it really just seemed to kind of click for me.
Definitely an important topic, and one that you're definitely an expert at, and we appreciate you sharing a wealth of knowledge about this fungal disease that I hope that clients out there, pet owners out there, may take a second look if they notice something a little out of whack with their pets. So Dr. Jennifer Reinhart from the University of Illinois Veterinary Teaching Hospital, thank you for being a first-time guest, hopefully a returning guest.
Absolutely.
To the Paw Report.
Yeah. Thank you for having me, and I hope everyone's learned a little something today.
They did, I'm sure of it.
Fantastic.
And thank you, our viewers of the Paw Report, for joining us for this episode. Until next time, we'll see you then.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care, because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.